First of all, I want to thank you, Waters and Wyatt, for inviting me here. I have a very long relationship with Wyatt for the last probably 5-6 years, even before I became Waters as well. I'm based in the UK, in London. We are a small company, medium-sized company called Aviado Bio, and we are based in Canary Wharf, which is now the new scientific center of the UK in London. Today I'm going to talk to you about the GTX Premier columns coupled with the MALS. As Adrian said before, there shouldn't be any SEC without the MALS from now on, although many people still think that, of course you can do it, but the information you get is always less than what you think it can be. Just a quick, because since we are probably a small company, many of you know who we are. We are a spin-off of King's College, London. Our founder is Professor Chris Shaw. We spent all his career next to people affected by ALS and frontotemporal dementia. He's a full professor at King's College, and about 4 years ago, the company started. We got founded. Johnson & Johnson is one of them, our founders. And about 2 years ago, we raised 8 million pounds, and the company finally was born. So we are a spin-out of this just said. Our focus is we target neurodegenerative diseases. For the brain, especially, and the spinal cord. We have a platform where we inject directly our lead program, which is called the AVB101, now in phase 2 clinic, which is for the frontotemporal dementia, or FTD, for those patients that have a mutation in the GRN or progranulin gene, or granulin. The first human has started about less than a year ago, I would say, or about 1 year ago. Our platform is an injection directly into the hypothalamus, which gives us a very low dose of a viral vector, so minimizing any side effect, a lot of side effects. At the same time, we are also building our pipeline, and we're about a company of 60 plus minus people, including CMC, where I am, clinical, finance, and the whole team, and discovery, of course. And it's shared between US and UK, but the labs are all UK based. So this is our lead candidate. It's called the AVB101. We base mostly in FTD for progranulin, so we do gene supplementation in one case, but we do also gene silencing with knockdown, and this is our second program for ALS. Just last few words about our lead candidate, because it's now in clinic, is AAV9. Why AAV9? Because it has been already approved by FDA. It's a neurotropic, so it can travel through the brain. We have our optimized granulin gene, and then we have the 2 ITR regions for people, in the cell and gene therapy. We know that this is the typical structure for the AAV9, for AAVs in general. And then we have a neuronal promoter, which is specific for the brain and allows a very high expression of the transgene in the brain of rodents and humans, of course. Okay, so to be successful in your cell and gene therapy, since we are talking about extremely complex products, as Adrian already said before, the critical quality attributes are a lot. There are many things that actually you need to measure. Our approach to the CQA, is to improve the quality of your vector. How to improve the quality? So we do an extensive analysis of our vectors, especially from using orthogonal techniques. So you never face authorities with only one technique telling you, for example, the titer of your preparation. You want to always back it up, even though you present only one technique to the FDA, but you know that you have tested it with other techniques regardless. So these are all techniques that we use in-house, other than the one that you see with the stars. We outsource them, because as a small company, we don't have, for example, mass spec, which is missing, so we outsource it. AUC and CryoTem, which are the golden standard for gene therapy, we outsourced. All the rest is done in-house. Today, of course, I'm going to talk about the SEC-MALS and look how actually it touches already 3 of the 5 most important quality of the CQAs, which are the full empty ratio, which is probably the most important topic of this talk, titer, which is related to it, and the structure when it comes to aggregation, which is one of the other problems with the AAVs, depending on serotype though. Why we look at full empty? This is quite an old, I will say about a few years, right, 2021 figure. It kind of gives you an understanding, or you see how many techniques are involved in when you want to see the titer of your vectors. You never rely on one only. You want to minimize your empty particles because they can be potentially immunogenic, they can interfere with your potency assays, and your DSP, so your downstream processing becomes lighter when you're better, works better when you have more enriched particles. So as a target, we want to have at least 80 or 85% full particles in your drug product. And if you're lucky, if you have a good process, your harvest will have about 30, 35. If you're lucky, 40, if you have a very solid process. So there is a big amount of, a large amount of empty particles in your harvest. How can you measure? AUC is the golden standard. All the CDMOs work, unfortunately, with the AUC, which is a kind of an answer when you want to face authorities because it's not exactly very GMP compliant. CryoTem is the other one. We use it as a test release, especially for GMP, but the prices are extremely high, especially for a GMP cost. We're about 11,000, 12,000 pounds per sample. So it cannot be done routinely. You do it for your test release batch. Very commonly used, but mistakenly, in my view, is the combination of ELISA and PCR methods, especially when you use qPCR, forget it. At least use the ddPCR, although it's more expensive, but the variance is very low. But remember, combining 2 assays, you combine 2 variances, so bigger error when you want to look at the titer. Then we have a very easy 260-80 ratio, although it has been published, maybe 230 to 80 is also a better option. It's not quantitative, it's just more a qualitative technique. And then there is the SEC-MALS, that's the one we chose in our lab. It's a big investment, I won't lie. Between the LC and the MALS, you need to spend about £500,000, but it's worth the money because it streamlines your process development inside. Yeah. Our colleagues from CryoTem wouldn't be that happy about this graph because they are in the purple area. But CryoTem, anyway, is always the technique that allows you to see what you actually produce. This is what we use, the new columns from Waters now. We use a pre-column as well of just a few centimeters. And the reason why we use a pre-column is because we use, as I'm going to show you, this technique in all steps of our downstream processing. So sometimes we have no very clean samples, so to protect our column, of course, we use our pre-column. That's why after about 200 injections, we replace the pre-column and we can continue. We've done some extensively study here where if you leave, you can leave it for longer, but why risking? And so these are quite cheap to buy. We work with a flow rate at 0.5 ml per minute, some experimental settings, mobile phase, phosphate, but you use any other pH, which was 7.5. Remember to add salt. At least 0.2 molar are essential to have a good MALS or SEC-MALS data, especially for some serotypes like AAV2. You won't be able to see aggregations unless you increase the amount of salt. Running time in 34, 40 minutes. The analysis is only 50 minutes per sample. Is really brilliant. And detection, as Adrian showed before, is UV fluorescence. You can combine it, but not use it for the analysis. Light scattering and refractive index. The information is here, is everything, almost we're looking for in a process development stage. So we work with the Dawn and not the Ultra Dawn that Adrian showed you before. So any analysis that we do here, it will be done offline or at line in this case. We can afford the high flow rate in this system. Okay, but still we have 35, 40 minutes analysis. The past and present. Since we were clients of Wyatt even before became Waters, we were using Wyatt columns. And here is, although they do the job, they should do the job, they gave us the titer, they gave us the radius in a good way. However, look at the resolution now. And this is an AAV9, which they don't tend to give much aggregation. But if you switch to AAV2, the story completely changes. I'm not allowed to show you the AAV2. We're working here, so I'm going to show you the AAV9. Very small aggregation peak, but even then, the resolution goes to baseline. Basically, we have a resolution of 1.3, just goes to baseline. So we're very happy with that. When we use the technique, almost everywhere, capture chromatography to assess the yield, and to assess the loading capacity of the polish step, which is extremely important. Otherwise, you overload and lose. We know how expensive it can be. Polish, just to assess the full empty ratio, the enrichment process that you have done, that you're able to do. A TFF step, which is probably the most crucial one, because as we saw in the presentation before, you want to be sure that you reach your concentration target. We cannot do inline measurement here, but as you concentrate and you take a sample, you load it into your SegMals, is a half an hour run, you can put inside the lab, you can put your TFF system on hold, in circulation, wait for the analysis, whether you get to go further or stop. It really streamlines your workflow. Before, we used to just go by volumes, then stop at the volume and then measure with ddPCR or qPCR, whatever you use, and then wait for hoping that you get the final result. Of course, we use it for drug products, titering particles, full empty ratio, aggregation. Of course, remember, this is always supported by orthogonal methods, never alone, although it's very powerful technique, but never rely on one technique only. And one of the things that we really love about the technique is the stability study, because stability studies are quite painful, especially long. They can cost a lot of money too, and having a technique so easy to work with, it just changed the way you think about your analytics. Then we took a step further, and also we're able now to analyze unclarified, but remember to pre-purify your samples. So in-house, we developed tiny columns where you capture your AAV particles. Can be in AAVX, can be in a monolith. Now Sartorius will sell you the 96 well plates with a small amount of monolith. You can use to capture your AAV, although it's not super quantitative, but will give you an understanding of how many full particles you have. In cell and gene therapy, remember, we don't want just more particles, we want more full particles. That's more preferable than having more particles. Okay? Otherwise, I'm increasing also the empty, it doesn't really matter. Some of the work we've done with the GXT Premier columns, the injection for these columns is up to 30 microliters, but we stretched a little bit. We went over and we inject even 40. Even then, you keep the linearity of the sample. So here we are assessing 3 different samples with different percentage of full particles. No matter what's the percentage of full particles, the analysis is constant. Whether you inject 5, 20, or 40 microliters. You can see that 40 already you're skewing a little bit your analysis because you're over the limit of the capacity, but we are still with a decent R-square. These are the outcomes that come from the Astra software, from the mouse, and you can see how the empty particles the red ones are the full particles, and the total particles are there. So in each measurement are very constant. Some other considerations. So to make this technique work well, there are two numbers that you need to know, actually four, and the extinction coefficient, this epsilon value. Wyatt will offer you some generic values which they work, they do their job, but if you want to increase your accuracy, it's much better to develop your own, so to calculate your own, which is quite easy to do. It takes about 3 weeks work, but it's very easy to do. With the new columns, with the GXT Premier column, we can work with pluronic-free. Pluronic, which is often used in cell gene therapy as a protectant, is a stabilizer for your particles. But on the other hand, has been proven, there are already a few articles in literature, acts as a barrier for the membrane. So it can make your viral vector less permeable to the cell. So if you are if you're doing some potency assays, you would rather be without. So we developed in-house a process that is free from pluronic, and we can easily work without pluronic even in set mouse. Always perform triplicate injection, like in any assay, of course. We have seen for some reason why the TFF may inflate your titer temporarily, because if the sample then stays overnight at 4 degrees, the titer goes down. We made this aware, Wyatt, in the UK, your colleagues, and we didn't get still an answer about this. So just be aware that it may happen. The linearity is there, and the downside of the technique, the mispackaged are lost, 50-50 between full and empty. In terms of sensitivity, we have done a few experiments here, and we noticed that if you approach about 2e to the 11th particles per ml, regardless whether they are full or empty, the error of your measurement goes away, it's lost. 2e to the 11th is a very good sensitivity. If your process has less titer than this, I would say better look at your process and not to the analytics, because it's quite low titer. Aggregation. This is an example where we shouldn't do most of the time SEC without the mouse. Often we have been told that the fluorescence is another way of analyzing AAVs. This is because they are rich in tryptophan, so they react very well with fluorescence. And they've been used extensively for measuring aggregation. However, the mouse offer you a much more sensitive technique, and following the theory, the bigger particles scatter more light. Actually, the same sample, whether you're analyzing on the fluorescent channels, on the mouse channel, you can see, although it's very low aggregation because it's an AAV9, we have about 4 times more of aggregation in this sample than measured just with fluorescence. So with fluorescence, be aware you may underestimate the amount of aggregation in your sample. It's been advertised by Wyatt for sure. The mouse is an orthogonal method to AUC, which is considered the gold standard for gene therapy. We wanted to try on our own, and we did it, and we did these 3 samples with 15% full, 55%, and 95% full. They all, the technique is really orthogonal to both AUC and cryo-TEM, with 1 fraction of the cost and the time. Internally, what we do, since for us the dPCR is the release method, especially when we work with CDMOs, you work always in genome titer. So over time, we developed, we collected a lot of samples, of measurements, I would say, and compare the 2 techniques, how they align, how they compare. Because the genome titer for the dPCR is what we use for animal studies and for clinical studies. We can see how good the alignment is. We are always plus minus, but we are always below the threshold of the 20%, which is for us is where we draw the line. So we always found a very good correlation between SecMouse and the dPCR together, other than AUC and CryoTem. This is an example on how the technique can be used extensively during your process development. This is our process. From the upstream, you go to a clarification step. It's a classical AAV process development or downstream processing with a capture step, a polish step, a TFF experiment, filtration, and then final finish for the drug product. Here there are two different products where we have to, so we develop for these two different extinction coefficients. And you can see how if we compare the dPCR with the SecMouse, the titers are, there are some differences as you think, and expect, but they never go higher than 20%. There is more variability when we are after post-capture, but the material at this stage is a bit more dirty. And this is probably one of my last slides. The limitation. So the technique has beautiful, pros, and we couldn't imagine a lab without our mouse for gene therapy. However, it won't tell you the whole story. This is a typical peak from SecMouse, where you can measure your aggregation, your empty particles, full, total, and the last scatter is on top. But below this peak, there is a much more complex story, because AAVs are not just full and empty. There is a big shade of grays in between. In-house, we developed an AEX method. Fun enough, it's done with a short column like we saw this morning. We use only a 4 centimeters column. It's a GAR column, actually. And look at how the same samples analyzed with AEX. It gives you a very more complex analysis. If you look at the empty-full ratio here, the first peak is the 100% full, or what we think is 100% full, due to the 260-280 ratio, which is 1.3. And then as you go on with the gradient, there are differences whether we think they are about 35% full because the 260-280 is 1.1 or completely empty, and so on. So this is just the two techniques align, of course. There are some differences. The AEX tend to be slightly less, probably because the mouse doesn't, let's say, doesn't see the difference between the one that are partially full. Yeah? And that's probably the reason. But causes for heterogeneity can be differences in the DNA cargos. You only have a fragment of the full length. Some PTM analysis, some PTM like oxidation or deamidation, and different ratio VP1, 2, and 3, which are also possible. To conclude, so the SEC column from the GTX series, they gave us now better resolution and excellent mass balance, and we measured this also by the dPCR in terms of genome cargo. The SecMouse is absolutely, when it's fully developed and well developed, can be very orthogonal to CryoTem and AUC. Only 40 minutes for runtime. No sample pre-treatment required, which is a dream. So you just take the sample and inject it. It can be used across all the DSP steps. Remember, if you are analyzing some clarified material, just pre-purify the sample. And we, of course, will know information about partial overfilled or capsid variants. And then the last comment is, unfortunately, many CDMOs still in the cell and gene therapy space don't have even an LC system. So we find ourselves to develop the method and keep in-house because we cannot transfer to anyone. Most of the time, they still rely on AUC and the CryoTem after. Okay. So we hope that you guys do some, you help us in this to spread the word. And then I would like to thank Waters and Wyatt, both, especially the people I've been talking to most of my time, which is Curtis and Valeria from Waters, and Kevin Jackson, which is, I don't know what we do without him in the UK, because he solves all the problems. and Richard and John for all the continuous assistance that they gave us throughout all this time. And happy to take any questions you have. Some time.